Hello, I'm Paul Baylis. I'm one of the A&E consultants here in Altnagelvin in Derry. Why are we under pressure? Well, guess what? Due to COVID, nursing staff are down by about 15%, and that really does hit us very hard. What's happening in the emergency department here is we're getting more patients in the front door, and we're getting less patients out the back door up to the wards because of all the pressures on the wards and the difficulty discharging people from hospital. So, to give you an example, we've often got 40 plus people waiting for beds here in A&E. I've got 30 spaces. So every space is rammed, there's people sitting holding drip stands, and that's the situation here in A&E. It means it's not really an emergency department. What it is an acute ward with a little bit of emergency department tacked around the rim, and that's the pressures that we're under. So, okay, nothing but my problems. What could you do to help? Well, I suppose the first thing I'd say is you need to ask yourself seriously whether what you have is an emergency, because we're rapidly approaching the situation where we're emergencies only here in Altnagelvin ED. We're talking, heart attack, chest pains, strokes. If you're diabetic and you're unwell, if you have a broken bone, please come. But if you've maybe had a bad back for 6 months, maybe that's something you need to contact your GP about and go from there. So that's one message. A second message is to try and avoid coming in the first place. So don't get COVID. How can you not get COVID? Well, you reduce your risk of COVID if you wash your hands, if you socially distance, if you wear your face mask, work from home, etc. Third message is please get your booster. If you do get COVID, and it's a lot of it out there, let's face it, you're much less likely to have to come to see us here in emergency or the hospital if you've had your booster. So that's the third message. The final message is, as I said, the difficulty is getting people out of hospital at the moment, particularly the elderly people. If as a family you're able to support the discharge of an elderly relative from hospital, that's one more bed that created in the ward, which means one more patient moved up from ED, which means one more patient taken off an ambulance trolley, and another ambulance available to go out and pick up, God forbid, another one of your relatives. So please, as a family, if you can pull together and help facilitate the discharge of an elderly relative at this time, that would be very much appreciated.